Your patients aren't just people that live in the Boston area. You accept patients from all over the country. Tell me how, if I have a client that's in Indiana or Louisiana or Wyoming, tell me how they find out about you and your research and your progressive treatment of mesothelioma.
The website is brighamandwomens.org. And when they get to that website, they'll see the IMP. They can click on it and go right to a very comprehensive web page that will acquaint them with the IMP. There's a number of stories there by patients themselves who've been through the program, and they'll talk a little bit about what they went through and how life's been afterward. So it's a comprehensive website, and I think patients and their families will really benefit from looking at that.
When one is diagnosed, what should they do?
Well, number one, try not to panic. Okay, try to remain calm and realize that mesothelioma is not the death sentence that it was 20 years ago. There is effective therapy, and for the majority of patients who are deemed candidates for an aggressive treatment strategy, quality life extension is possible. And so I would let people realize that we're going to take it a day at a time. And number one, let's get into a treatment program either here or elsewhere in the country that will allow experienced physicians, experienced in the treatment of mesothelioma, approach them as patients in a way that is knowledgeable and aggressive.
Back in the 1980s, when I was first trying asbestos cases, when I would talk to a family that had just received a diagnosis of mesothelioma, the first thing that they felt and the first